reports with these systems. So diagnostic and imaging is increasing the sensitivity 18, 70, 92% using AI, and improves the precision by up to 14%, the reports. Also with infrared is almost the same. We can have a predictive analysis, intelligence patient monitoring, so not just a graph, not just a table, but predict the risk in months or weeks or in years. So when we say prediction, it not means that you really have that. No. If you don't do nothing, you increase the risk, but you can change. So we can, as we are using a functional exam, we can change the way and say, oh, we can stop here and try to do better things. Supplementation, good nutrition, exercises, or some specific kinds of medical foods, and many other approaches. Let's see here. Here's an example. Patient asks, could you please advise me on which doctor I should see based on these symptoms? So there's a speech recognition in a natural language process, and this information goes to a neural networking. The patient can do outside your clinic, but can do this inside your clinic. And there's a natural language generation that answer this based not only on the patient information, the patient data, but also on the infrared imaging collected on that moment, captured on that moment. Here, an example, the answer, he says, you don't require the attention of a specialist. A primary care doctor is the best option for now. Okay, saying it's understand that most of the time you don't need to spend so much time, so much money in some specific situation, and it's also important to reduce costs for the patient. Trend 4 is big data and analytics in telehealth. I can talk this in another moment. Telepharmacy is very interesting here. What is happening? The reports are being connected with treatment approaches, medications, and that go direct to a pharmacy or to a clinic that gives supplements or something like that. So you can connect the report with a system like a telepharmacy in a telehealth system, okay? So could be remote, dispensing, automated solutions, medication therapy management, advanced digital tools. So it's increasing this kind of approach, and maybe in the future, you not need to go to a pharmacy, but will get out from the clinic with all the prescription, and when you return to your home, your medications in the door before you arrive at home, and you start your treatment. So it's possible. And it not means that all the cases will be this way. Telepharmacy and practice, very interesting. So report, doctor approach, do the prescription, the prescription go to the pharmacy, and pharmacy gives you what you need to take. IR, VR in telehealth, we can talk this in another moment, not today, but it's about rehabilitation, telesurgery, seeing surgery with infrared imaging, seen in a metaverse, or surgical planning and assistance, or post-surgical monitoring is very interesting, but let's talk in another moment. The 7th trend is wearables and telehealth APP, like watchers and other things but it's not today. Medical drones that will can work with together with the pharmacy and delivery of the things. It's another topic, but it's a trend. And so there are a lot of new things for 2025 in all the world. Let's go ahead here. So, but how can I start my telemedicine service, or how can I increase my telemedicine? We have some steps. One of the most important is standardized protocols. Standardized protocol. Remember, routine. Standardized, approved telehealth platforms. So it's not saying telemedicine is not sending image by emails, by WhatsApp. You need a system with high security. In Europe, this is very critical. So all the world, but the Europeans, they are very delays from Spain. She knows that must be very, very secure the data. Yes, it's true, and they have a reason about that. And we must follow. So if we want to follow a good practice from security, see the European protocols, the best ones. And this comes in some kinds of platforms, digital platforms that have these systems in the back end. So you don't need it, it's just programmed on the system, and you only use a dashboard. And the other point is the function, to think that we are not talking about MRI, CT, ultrasound. We're talking about functional diagnostic tool that complements structural imaging. So many people will say, "Oh, but it really works. Thermography works. Thermography has evidence. Thermography has." Okay, sure, we have, because it's temperature. And what means temperature? It means metabolism. It means inflammation. It means perfusion. It means circulation. It means vasomotor sympathetic response. All these things are biomarkers that is well documented by infrared imaging. In a different way as ultrasound, MRI, CT, we are documenting the functional state of the body. So sure, I not want to explain here because it's not a class about that, but you must understand that in the telemedicine service, we don't have most of place functional diagnostic. So when most 99% of telemedicine approach are based on anatomic exams. So we have a big space, a big opportunity here to use telemedicine. And when I talk in functional exams, I'm saying many applications: vascular disorders, ischemia, neuropathies, radiculopathies, tunnel carpal syndromes, inflammation conditions, arthritis, bursitis, sport injuries, chronic pain management, fibromyalgia patients, myofascial pain syndromes, pre-surgical planning to study the risk of cardiovascular problems, ischemic problems, to determine, for example, varices surgery to map the superficial veins, applications on diabetic foot, especially complications before or when we have a complication like an ulcer and you want to monitor the healing of that, the recovery from a pain, from a trauma, from a medular trauma, for example, post-surgical complications. So to monitoring if the plastic surgery is okay, if the breast after the surgery is okay, the abdominal plasty. So we have a lot of applications of telemedicine using the functional diagnostic approach, okay? And our focus is much on early stage. This is the point, because you can say, no, but I can see this by ultrasound, I can see this thing on MRI, I can see this on tomography. Okay, but in an early stage, much more in an early stage, so early as infrared, 99% no. So if you understand, if you have someone specialized that understand the disease, not just understand infrared imaging, but understand what's behind the infrared image. So if you want to know to interpret imaging, you must interpret the disease first. You must interpret the patient, the symptoms, and you must know what are the main diseases, what happens. So we can also we can use this technology to early stage. One basic example is rheumatoid arthritis. Can list 5 years or sometimes 10 years, some autoimmune disease to be discovered or to be said, no, it's really a sacroiliitis, or it's really a the autoimmune thyroiditis. So with infrared imaging, we can have a very early stage approach. Dermatomal distribution, it's the only exam that do this by imaging. So you can connect it, the information very similar to electroneuromiography, but seeing on the same image, not the dermatomal or the radicular pain, but with the inflammation on the joints or the postural changes or the myofascial changes. So it's very good for the study of mixed pain. Mixed pain means nociceptive and neuropathic pain in one exam. And sure, full body image is the best approach. We can do parts of the body, but full body with a lot of image, not just 2 images, but with 1380, 132 images, and also with these images, we can have a full approach of the disease for early stage diagnosis, and especially focus on timely interventions. There are no means to do a report if you don't know how to do the intervention. Okay, I have a problem on the shoulder, I have a problem on the knee, I have a problem on the breast, I have a problem on the face, but what is this? And is urgent, not urgent? I can wait, I need to another exam. So the report must be something complete and helpful for the patient. Okay, understanding this, let's return again for the standardization and protocols. Protocol, the basic, patient preparation, no sweat, no shivering, well exposed, could be full body, could be a part of the body. Environment controls in Celsius, 23 degrees Celsius or between 21, 23. And so environment controls, no wines. Anatomic regions of interest. Okay, I have this problem, but where the anatomic regions of interest, where are the regions that I need to focus when a patient has a headache? It's not just one image from front face. Must be lateral view, posterior view. And we have some discussion, for example, for breast here in the American Academy of Ophthalmology, and most of the time, Professor Schwartz also take our attention with the problem of dermatomal problems associated with breast changes. We must take care that sometimes the breast could be different, look like something wrong, something suspicious, but if you don't do the images of the arms, front and back, some situations you can interpret wrongly, think that we have a problem on the right breast. No, it's not the right breast. It's a low-level radicular problem. T1, C8, most of the time they change the temperature, they change the temperature of the breast. But no worry, just to say that we have protocol for that. And also we have a solution that I will say in the next minutes, how to solve this problem. Okay, protocols is important for telemedicine platforms. Infrared cameras, appropriate one, could be portable for point of care or could be non-portable. I explained this after. And also a board certified specialist. So this is why here in American Academy of Ophthalmology, we say, become member, do training, looking for experts, looking for people here to help you to understand, to interpret correctly, to work with you, make connections. But please be a certified member. It's not just to do one course, for example. I did many courses, and my students did many different courses in different levels, in different moments. So sure, you start the base one, then you wait, then you go to a level 2, wait, you have a much more doubts and you want to increase your service, you go to a level 3, a level 4. It's endless. So the acknowledgement is endless. It depends of your time, of your dedication and what you're looking for. But you must understand that's important to be certified, to have the basic, and continue doing training, okay? For you to turn an experienced professional. But here on the telemedicine service, although we have an experienced professional, it's interesting also to have more experts, more or seniors that can help on this process. That seniors can supervise it, trained physicians on this process, or training technicians, or training nurses. So supervision on this is very important if you have many people involved on this. Let's talk about infrared cameras. So in telemedicine, we can use portable cameras for telemedicine and no portable. So it means that we can have a point of care approach and standard conventional approach. And portable is good because you can do very fast image. No portable is good because you can have a better accuracy of image. You can do a lot of image. So it depends on the situation. Both situations are good and they complement each other. I can have one situation, I can have other situation, I can have both situations on my clinic or on my hospital. And the experienced professional, they can work in 2 different ways. In real-time imaging, that we call synchronic approach. Synchronic approach is the point of care. So I'm seeing and I'm telling to the patient what is happening on that moment. I'm seeing that we have a problem. Houston, we have a problem here. Call Dr. Jen to come here immediately because I'm seeing that there's some problem here. And no real time, asynchrony, the traditional one. So we can, you take the images and you have time to think about, to see what I can do, okay? Real time imaging, pocket of care is good because it's speedy on that moment. There's a specific situation, emergency and other thing. No real time is good because you have more accuracy. You have time to think, you have time to analyze. You can use another tools, different softwares, AI, so many different things. Speed here is good because you can also do remote patient monitoring. I can say I can put it here, okay. And with portable or non-portable. And speed is good also for that you can, most of the time you use it for triage systems. We call this in research longitudinal tracking. What's longitudinal?